When a stye is very inflamed, we can inject it with a steroid or an antimetabolite to try to calm down the inflammation. This procedure is relatively quick and actually isn't as bad as it sounds. Sometimes it needs to be repeated though, about 2 or 3 times for it to fully work. Although we always hope for it to be injected once and then be done with it. Most of the styes are significantly smaller about 2 or 3 weeks after I've injected them with a steroid. The main risk to injecting styes with steroids are skin depigmentation, so it can get a little bit lighter, or skin atrophy. And while the procedure is very safe, there have been very few case reports of vision loss after a single injection, though I wouldn't expect this because we're using such small quantities. This is why, though, we always try to do warm compresses and topical eye drops before injecting styes, especially since the majority of styes will go away after doing these conservative measures properly for about a month or so. Other risks that you should know about include bruising, which usually lasts for about 1 to 2 weeks, and swelling. Using Kenalog and 5-fluorouracil to treat chalazion is an off-label use of these medications, but many ophthalmologists use it as such.